Good morning. How's everyone doing? Thank you all for being here for this discussion on consumer education and industry responsibility. I've got an incredible group of panel members here to introduce to you. I'll be moderating today's discussion, but we're just going to kind of pass the mic. I'd first like to give a little bit of an introduction about who I am and what I do, and then each of them will do the same. So my name is Christine Adams. I am currently an assistant research scientist at the Texas A&M Transportation Institute in the Center for Alcohol and Drug Education Studies. With that said, I am incredibly grateful that Texas A&M is hosting this conference here today, but I am not here in my official capacity. I'm here on my own time, and so the opinions and knowledge that I share with you today is my own expertise and is not endorsed by the university or my agency. So with that disclaimer out of the way, I will let you all know that I spent about 17 years in the alcohol industry as a server and in the marketing department. My last day in that industry was as a marketing director of several properties. One of them was located directly across the street from a university, University of Nevada, Reno. And our owners were actually incredibly interested in understanding how the university felt about us working with their high-risk population. So we were in the business of selling an impairing substance, but we were also marketing to a high-risk group. So I engaged in conversation with student conduct and police services as part of my job. When I stepped out onto my own, I was going to go into marketing for small businesses, and what ended up happening was I picked up a bunch of public safety projects, primarily working in the arenas of youth protections, the young adult population. So think, adults, but still not completely fully developed brain, a little more risk going on in that age group, and then impaired driving primarily. So, and that's kind of what I'm still doing today. I was in the state of Nevada when cannabis was legalized for adult use purposes. I did participate in a lot of steering committees and testified at the 2017 legislature where the rules were set. And then moved back here to Texas to find a completely different landscape than what I was used to out there. And what I will say to you is, with my background in mind, I understand that there is a way to bridge the gap between public health and safety professionals and an industry who's selling a substance. So here in Texas, we don't have a regulated adult use market, but what we do have is the hemp consumable market. And so I'm going to equate those two to the same because I work kind of more in the behavioral realm in terms of traffic safety and youth prevention. So my main points when it comes to consumer education is the driving component. Every state has struggled with helping consumers understand that it is illegal to drive high and that it is an impairment to the driving test. So that's first and foremost. I would also say the combination of alcohol and THC is not only a health concern, but definitely a critical threat to our roadways. I think those messages need to get out, and I would encourage the industry to find a way to educate their employees to foster sort of this idea of education understanding so they can pass that off to their customers and consumers. Also, from the industry perspective, I would say that products and packaging that is appealing to young people should be avoided at all cost. There's some interesting debate about, I don't know that they're advertising to youth, but that's definitely appealing to youth. And we have decades of evidence-based strategy that shows that when we have responsible marketing practices, that youth access and use does go down. So those are kind of my primary points. I'm going to go ahead and introduce to you next Dr. Lindy McGee. She is an assistant professor with Baylor School of Medicine.
Hi, so my name is Lindy McGee. I'm a pediatrician and general pediatrician. I have worked in private practice and now I'm affiliated with Baylor College of Medicine. So I teach residents in an underserved clinic. Being in academic medicine means I also have a research interest as well. That has been cancer prevention for a long time. For a long time, that meant that my concentration was on HPV vaccination and increasing those rates to prevent cancer. But then, like, why are you here then? Then in 2018, when we saw the new vaping numbers, I really got interested more in tobacco, vaping prevention, cancer prevention. And then what I noticed when I went and talked to schools about e-cigarettes and vaping, and when I was talking to my own patients, that they were more likely to be vaping THC products than nicotine products. And I thought, well, we need to learn more about this. I'm also on the chair of the Committee on Child and Adolescent Health for the Texas Medical Association. So I'm involved in a lot of advocacy work through all of this stuff I do on the state level. I'm very concerned with what I'm seeing with my own patients and what I'm hearing from the emergency room with toddlers getting into these products and youth, adolescent recreational use. I am not talking about medical use here. I think these two will be talking about that. I'm talking about recreational use. What I'm seeing and hearing from my emergency room colleagues is that we're seeing increased toddler ingestions. There was some data out of the Fort Worth area that showed in one ER, they had 5 toddler ingestions in the year 2019, 8, and then 58 in 2023. Their calls for poison control increased by 1,000% during that time. What you need to know about toddler ingestions is toddlers are little and it doesn't take much, right? With mild ingestion, they'll be in the ER with altered mental status. That means at the minimum, they're getting blood work and normally a CT scan of the head, which exposes them to radiation. It also sometimes will need a spinal tap. In severe cases, and in one study, that was about 9.9% of emergency room visits end up in the ICU for low blood pressure and respiratory depression. So this happens. It's happening more frequently, and it is a major concern to me. It is ridiculous to me that my fiber gummies are in childproof packaging, but these products are not. I'm currently working with some residents on a survey of vape shops and smoke shops in the Houston area, and what we're finding is, THC products that are look like Nerds candy, that look like Captain Crunch cereal, very obviously to me targeted towards the youth market, and not in childproof containers. Every single vape and smoke shop they visited so far sells THC products. Only 30% of them have both inside and outside labeling of age restrictions. So the other thing, it's not just toddlers, it's adolescents as well. If there is one point that I would like to stress here is that the youth brain is not the same as the adult brain. It is not the same. And when I say youth brain, I mean under the age of 25. Our brains, we are born as babies with 15% more neurons than than an adult brain has. And the babies in those first couple of years of life, and this is why this is so important, just make rapid connections in those brains. In adolescence, we prune down those connections. We're in the process of pruning them down. So when you add THC to the brain during that process, it has effects that it would not have during adulthood. Effects that we know of definitely increased risk of psychosis, and that is something that we're seeing in the emergency rooms. Teenagers coming in with cannabis-induced psychosis, cannabis-induced suicide ideation, and then we're also seeing more and more cannabis hyperemesis syndrome. We also know that the younger you start using, and if you use the higher dose products, which these vapes have very high concentrations of THC, you're more likely to develop cannabis use disorder. So that is what I'm here today. I want to make sure as we're discussing policy, we are talking about doing everything we can to make sure that adolescents and youth do not have access to these products, and making sure people know the reason why. Why do I care about 21? It's not just because I'm being a meanie. It's because the brain is different and we need to protect that brain.
So thank you, Dr. McGee. Next up is Liz Cross. She is a nurse practitioner and with Pediatric Neurology Consultants of Austin.
Hi, so I'm Liz Cross. It's correct. I work with Child Neurology Consultants of Austin. It's a neurology group for pediatrics only. And so the juxtaposition is I'm on the medical side of this. So yes, they're developing brains, but we'll get to that. And so I got into this back in 2020. I left I've been working with my group for over 13 years. I left the hospital and started looking at CBD in late 2019. That's when autism was approved as a treatable diagnosis through the compassionate use program. At that time, I went to my providers and I said, what do we plan to do? And they kind of said, we don't know. And so they wanted guidance, they wanted support, they wanted help with education. So I said that I would do some of that, but my biggest key was that I did not want to cause harm to these children later in life. So I took months, my own time to research, study, get educated to try to find out what I thought risks and benefits might be that are true. There's lots of information out there. It's hard to filter through all of it. So in January 2020, I had already pitched to my practice this idea of a CBD resource clinic. I called it CBD because we're in the state of Texas, and this is a CBD low THC state. It is, of course, only the products through the Texas Compassionate Use Program, so it does contain THC, all the products that we prescribe. And we started seeing our first patients in January of 2020. Initially, they were mostly epilepsy patients, but soon we started seeing autism. Now my split is probably 80 to 90% are autistic patients that are receiving this compassionate use cannabis, and then the rest are either epilepsy or spasticity. I can only see them if they have a neurological reason to be there in my office. They have to be established with the doctors at my practice first. They have to have an approved condition and diagnosis, and the doctors have to agree that they think they would be a good candidate. After that, they then come to me. I spend an hour as a new patient educating, telling them not just about what side effects, risks, long-term trajectory could look like, things we need to watch out for. But I also talk a lot about the Texas Compassionate Use Program here, what we have established, what the 3 dispensaries are. The reason for that is one of my key points is I want them to have good access to medication, clean medication. What a lot of people don't know about cannabis is it is really, really good about cleaning the soil. The soil. So you're taking everything in the soil and pulling it into the plant. So depending on what your plant is growing in, heavy metals, pesticides that are being sprayed on it, it's leaching all of that in there. So depending on where and how your product is being grown is what you're going to be getting in your products. So I, with autistic children particularly, don't want extra heavy metals. That would be terrifying for me. So the dispensaries here in the state, the 3 that exist, are wonderful. They're well tested. The products are very clean and safe. And to the side of the psychosis, it's interesting. So I've met with many other doctors who do prescribe in the state, and psychosis has been something we haven't seen. And the reason being, we are microdosing. We're not giving excess amount of THC. And so it used to be that every single one of the patients, I would talk about the risk of psychosis. I would tell them what to look for, and that was scary. And I still do it. Every single patient I tell to, but I say it in a different way. I say it to actually say how good and how safe these products are through the Texas Compassionate Use Program, through these 3 dispensaries. And so my biggest thing is I cannot have those dispensaries go away. I have to continue to have this medical program grow and get firm in this state and really take over, because these patients would not be able to have access otherwise. I do not know which direction I would point them if I didn't have these dispensaries to provide good, clean, safe products. Otherwise, I'd fall in the same thing of risks of long-term disabilities and all those things that I worry about with the developing brain, for sure. So I also completed a medical cannabis program similar to Piper at University of Maryland School of Pharmacology. And so I graduated last year in May. And then I'm also part of the DPS working group. So I work alongside DPS, who is actually in charge of the TCUP program here in the state, trying to continue to push our program to the direction that we really need it to go.
So now I'll introduce to you Aaron Bloom. He is an attorney and CEO of Doc MJ.
Thank you. Thanks everybody for coming. It's an honor to be here, an honor to be on this panel. I'm a healthcare attorney by trade, and I worked for a long term in the senior housing. So think nursing homes, assisted living facilities. And there were very few good days when a resident comes into a nursing home. The end is not usually good. And it's a very challenging medical patient. And when cannabis came to Florida, where I'm from, I got introduced to that, and I saw the benefits and how much it was helping people and really changing lives. And then we had these doctors who were nervous. They wanted to get involved, but of course they were concerned for their license and a lot of regulatory challenges. So it was my kind of goal to help the doctors feel comfortable practicing cannabis medicine in a responsible way. And that's how we founded and created DocMJ. The goal was always better medicine, better health and wellness in changing people's lives. And so the idea of safety and doing it right is incredibly important. The first thing that we did was we offer our patients their money back if they don't qualify. And the reason for that, it's not a marketing tool so much as a message to them and a message to the doctor that if a patient doesn't have a qualifying condition, we don't put you on the registry. You can have your money back and you can leave. And because we want to make sure that there aren't people taking THC who don't necessarily need it. So that was the first thing we instituted, and to this day, we've been doing it for 8 years now. And we turned down a relatively large percent of our population. In the early days, we went to a local college in Florida and marketed it at one of their events. The college students came flocking in, and they all left very disappointed. The doctors were upset. We turned them all down because they didn't have the qualifying conditions. And I think that's critical, that if we're going to have a medical program, that it is medicine. The second thing that our doctors tell our patients is to start low and go slow. We want them to find the lowest level of THC that they can possibly find the relief they're looking for. And we try to partner with dispensaries, unlike in Texas, and we're here in Texas as well and happy to be here. But in Florida, we have 22 dispensaries. And they all have different characteristics and different education of their own staff. We try to steer our patients away from the dispensaries that are marketing towards or pushing people towards higher THC. Is one of our other dangers that we work hard to prevent is the doctor gives them a recommendation. In Florida, it's not a prescription, it's a recommendation. But when they walk into a dispensary, that they don't find somebody there that tells them to take something they don't need. And oftentimes we find patients come back to us and they weren't successful, and that's because they were led astray once they walked into the dispensary. So we're trying to keep our patients safe by making sure they're getting the right medicine that gives them the best result with the least risk.
We've got a couple of open questions today, and Aaron, I'll go ahead and start with you and we'll work back this way. The first one would be, what is one thing that we can do today to improve consumer education?
The bottom line here is that the product has a perception problem. We've talked about that in the session before. You heard Piper talk about her story about her daughter. The perception for people is that this is reefer madness. This is just an excuse for people to get high. I landed here and got into a Lyft, and the very nice Lyft driver said to me, "Oh, you're going to the cannabis conference? I just took somebody else before." And I said to him, I said, "Did you know Texas had a cannabis program?" He goes, No. He goes, it's one of those things you just go, you have a sore elbow and you can get a prescription and get high. And that's what we're fighting against. So in order to change perception, we have to tell the stories of the medical benefits. You have to tell the stories of the parents whose lives were changed when their autistic children got better, when their autistic children had could live better lives. It changes the child's life, most importantly, but it changes the whole family's life. When somebody comes to us and you're a parent and you have children, you have a job and you're stressed, and after you put the kids to school, after you put the kids to bed, you have 2 or 3 glasses of wine, right? And when you replace that with a THC product that doesn't have all the negative effects, it doesn't have the morning after effects, and doesn't have the calories, and that literally changes your life so you can be a better parent, you tell that story to your friends, to your neighbors, to your coworkers. And that's where the perception changes, and that's where people are open to the idea that this is a safe product and something that really has medicinal benefits, and it's not just a product to get people high.
Yeah, so as far as education for me, obviously I spend an hour with each of my new patients. That's my biggest education time. When I started this and said I was going to be, helping pediatric patients get cannabis and use cannabis, I was very reluctant on how everyone would perceive me. I have 2 children of my own. They're 12 and 8. And the stigma behind it is real. And I have changed their stigma to it, I like to say, but maybe too far to the other end. Well, now they will go out and find pictures of cannabis leaves and go, look, Mom, it's the medicine you use. And I'm like, I don't use it, I prescribe it, right? And so they are lovely and have no preconceived notions of, reefer madness that we talked about. So education is huge, and the stigma behind it is huge. Educating that this is a medication here in Texas is big. And, another thing that I do also is I educate the ISDs. So the independent school districts here, we do have, through their policies, it is mandated that they are required to give this as a medication in school. That is something that is really hard for people to believe. I helped it get there. It's there. It's on the books. And now what I do is, because I work in Austin, Austin's pretty keen on this. Round Rock ISD was my first school district to actually have a patient on cannabis. And I have worked endlessly educating them, educating the staff, educating the health directors, and everybody down to the school nurses about how to administer, et cetera. So since then, the Round Rock Health Department head has advocated for me to continue to push. And so she has pushed me to other ISDs. She's invited me to the regional conference. And most recently, I attended the statewide ISD conference for health providers. So I spoke to 150 or 250 representatives across the state for the independent school districts. I educated them on the Teacup program. I just told them what it is. It's legal through this program, through compassionate use. Who qualifies? How does it work? How do we know if it's safe? How do we know if a medication that comes across our school nurses, table desk is a legitimate product for our patients to be taking, right? There are a lot of questions out there. Am I going to get in trouble if I give it to a student at school? Will I be deported, right? Will I lose my license? And so those are the things that I go out with education on top of just educating my patients independently, but also the school districts on what is legal and what isn't, to try to cast a broader web and really get more of Texas knowing how big it is.
I'll just
Oh, yeah, sure. So I obviously come at this from the different angle, whereas I think you are talking about people needing to understand that this can be safe. I'm concerned that people think it's too safe and not a big deal for adolescents, right? I heard someone say at a conference I went to, and I think it's very true. Right now, we have the highest actual risk. Lowest perceived risk with the highest actual risk with these products. I'm really talking about especially these vapes, which are 80, 90% THC products. And once again, talking about the adolescent brain. So my concern is actually that people culturally are thinking that these products are too safe, that they're no big deal. What I'm seeing in my clinic is adolescents who are using it with their parents, and their parents saying it's no big deal. I have had an adolescent who came to me concerned that she has depression, wanted to be started on medication for depression, but her mom was like, we don't use medicines in our family, and instead they smoked a joint together every night. The girl knew that she was self-medicating with marijuana, but I cannot prescribe something against her parents' consent to start her on a depression medication. So I guess I'm seeing the flip side of this, where I'm concerned. I think the industry has a responsibility to educate not only that there is an age of 21 and enforce that there is an age of 21 in these shops and on online sales, but also that the reason why. Because I think once people know more about the reason why, they will understand and comply.
Thank you. Obviously, I'm an impaired driving person. So of course the driving task is impaired with the substance on board. And that goes for anything, right? Over-the-counter medication, prescription medication. We definitely don't drive better if we have been consuming something, or if we're distracted, or we're angry, or anything else. So One big thing I would say is, and that has been something that all the states have struggled with as they legalize for the adult use markets, was educating the public on, you will get a citation, you can be in trouble if you are driving high. And so the second piece of that is that combining cannabis and alcohol has really unpredictable results. It is likely a public health concern, but it is most certainly a critical threat to our roads. Cannabis becomes the #1 drug category identified in drivers in motor vehicle crashes causing serious injury and death if alcohol is on board. So those two things combined together are seriously dangerous to our roads. And sadly, in Texas, and I think this kind of goes to the industry responsibility piece too, is that we do have on-premise alcohol license locations that are selling THC products in the same setting. This is strictly prohibited in states that have allowed for on-site consumption lounges. All of those states have said sales of both substances is strictly prohibited to consumers. And I believe it's for this very reason. I mean, we don't want to endanger our roadways. One thing that wasn't mentioned with the panel, which we kind of had a pre-discussion too, is I would also like to see the simplification of the certificates of analysis on these products that are being sold in the smoke shops. I look at those and I'm like, my eyes go cross and I'm like, what does it all mean? And I don't even think that the employees in those places understand what all of it means. We know we're looking for that 0.3% Delta 9 THC content. That's what makes the products legal. But past that, what are the ingredients? What are there heavy metals? Are there, and I don't even know. I mean, I'm sorry I don't have a really great answer on how we simplify those things. Maybe some of y'all can weigh in on this, but I don't believe that people understand what's in the products that they're consuming. So that would be a huge consumer education piece for me.
Yeah, I think there's kind of this division, and it's not purposeful. It's just so you get both sides of the story. And I think what you're saying is absolutely true. When we're speaking of the safe products and helping patients get access, we are talking strictly the 3 dispensaries that exist in the state that are medical, cannabis products only. Most of what you're talking about are the hemp shops, and the hemp shops are mostly unregulated. I'm going to say the words. Anyone else can justify it differently. There are some regulations. There are thousands of them. You heard me say there are 3 dispensaries that are controlled by DPS. DPS heavily regulates those 3. The 7,000 out of 5 to 7,000 hemp shops that are licensed here in the state are certified by a different company, not by DPS. They're dishes, and they do not have enough employees. I think it's something like 1 employee for every 1,000 shops, okay, for them to regulate. So they're unregulated. There have been some really good articles recently about these products and these shops and how they are actually exceeding legal limits because no one is coming in and checking them. There was one quote from one of the business owners when they walked into the shop that he quite literally said, "Oh, all my products will get you high." That is not what the state was supposed to stand for, right? That was not how it was supposed to be. This was supposed to be a hemp market. And what we've had happen is we've had this division where the medical consumers, right, are feeling like they're having a hard time accessing with those 3 dispensaries, and they're turning to hemp products that are unsafe in the sense that we don't know what's in them. They should have a certificate of analysis, which is usually a QR code that comes up to some kind of analysis of what the ingredient list is and percentages of all the components. Unfortunately, from what I have seen in the industry, that can vary. You can have a date on that that's 6 months old. You can have a date on that that's 12 months old. So the question is that product old, or have they been using that same label on multiple batches after that, right? There's no one to actually certify that what's in that container is that QR code, in fact. So I usually tell my patients that there's this Nestle Toll House cookie recipe, right, that we all follow when we want to make good Nestle Toll House cookies. But I bet if we all made them, they'd turn out a little bit different, right? But our ingredient list might be exactly the same, right? But this is different. This is cannabis. It's a plant. So you're having different amount of THC and CBD in each one of these, flowering buds that they're using. So even though it's, they used a quantity of weight, let's say 60 grams, to then make these cookies, not real cookies, but in my analogy, they're not going to come out the same every time because they didn't actually look at what that plant had in it. Okay. And if it's harvested in fall versus spring, it's going to have different concentrations. So it's really, really hard to be consistent. And we do have a problem. We have a split, a total divide from what I'm going to say is unsafe hemp market and the unfortunately underserved medical market.
Thank you for that. So our next question is, what is one action that the industry today, and I think y'all are going to have a different answer maybe than what we are, what can the industry do today to create an environment that addresses public safety concerns? Do you want to start first, Dr. McGee? Sure. I'll follow up and then we'll.
Yeah, I mean,
Each side.
The American Academy of Pediatrics and the American Public Health Association both have guidelines that are really around preventing youth use and preventing society impact, stuff like impaired driving, secondhand exposure. We haven't talked about that yet. That is something that concerns me about children and adolescents as well. And then the third thing we haven't touched on yet either, if this is an industry policy, this would be policy, but not criminalizing it, youth use. So making sure that the civil penalties fall on the person who is selling to the teenager, not onto the teenager themselves. We're not giving criminal records to teenagers who are being sold addictive products. So that, those are kind of the pillars of what we're looking at with public health. She mentioned before, we know what works with the tobacco industry. And if it's like, if we could start over with the tobacco industry, I would have them in containers that are not flashy and that just say, we went on a trip to Norway this summer and the cigarettes there just are gray and say cigarettes. That is the packaging for cigarettes there. It doesn't need to be in fancy packaging for adults to be able to use these products. It doesn't need to be Captain Crunch flavor for adults to be able to use these products. We should be making sure we are enforcing. With my vape products that are supposed to be 21 and up, I have bought several online. I click something and say I'm 21 and it gets sent to my door. The online market is out of control and we need to regulate that. And maybe just that you can't get these products online. Maybe you can only get them in stores. You should have to be 21 to be able to enter a store. You shouldn't even be allowed to be in the store. That we know that that's more effective than 21 at the cash register is 21 to enter the store. Last time I was in a vape shop, I saw a dad there with his 5-year-old daughter. And she was helping him pick out what flavor he should get. So this is the type of thing I'm talking about when I'm talking about we are not protecting youth right now.
So I'm going to scoot back to, you mentioned the tobacco industry. There were a lot of lessons learned out of that industry and also alcohol too. And I know at least when they were legalizing in Nevada, there was some organizations that came in that said, let's, regulate cannabis like alcohol. And I hear that a lot. And I suppose that's, alcohol is not the greatest industry ever. And in fact, in Nevada, we actually had no alcohol regulations other than you couldn't serve to a minor. We had no cutoff times, no dram shop laws, no alcohol control board, nothing. So when you came in and said, let's regulate this thing like we do alcohol, I was like, what? With no rules. But we do have some lessons learned from alcohol in that we do educate servers. So the same would go, in my opinion, for the cannabis industry, hemp-derived consumables, whatever we want to call it for now. Those folks that serve and sell these substances should be aware of all the concerns that we're talking about today and be willing to pass that off to the consumer, because the end result is, yes, please do lock these products up so your kids don't get their hands on them. Let's please do be very conscientious. I know the sign on the door says 21 and up, but we have to really mean that. And I think for me anyway, based on my experience looking at legalized states, those things have been taken very seriously in states that have regulated adult use markets. I know at least in my area in Nevada, you had to get through like at least 3, if not 5 different checkpoints before you even saw the product, that they made sure that you were of age and able to be in there. And those folks are really educated, although we did have a little bit of butting of the heads in the beginning of like, what does training mean? And the industry was saying, well, we want the bud tenders to know what the terpene profiles are and all of these things. And I'm like, but please do invite the public safety people to the table. We've got some legitimate concerns. We've already grappled with a couple of industries. We know what works. I don't think that we're asking anything completely unreasonable that's going to harm your sales, but you have to be considerate of these things because we've already proven that it's effective in keeping it out of the hands of kids and keeping kids out of ERs and in general for adults even making sure that they're safe too. So you guys want to talk about maybe the medical side from that industry?
Yeah, absolutely. And you brought up regulating marijuana like alcohol because of course we know that alcohol doesn't create any harms in our society. So why not? It's sort of an interesting, I always think we should regulate it better than alcohol. They've touched on the important topics and the safety the industry can do is what they've talked about. Number one, of course, we have to empower the employees to be the first line of defense to educating the public about how to use the product safely. The equivalent I can think of is a pharmacist, right? In traditional medicine, where do you get your medication? The doctor prescribes it, but when you go to a pharmacy, one of the questions that the pharmacist will ask you is, do you have any questions about this medication? And there you have a highly trained person who will tell you, what does it interact with? Do you take it on a full stomach? And there's somebody with some real education that can give a patient guidance. And when patients are on 5, 10 medications, that becomes a very important piece of the healthcare delivery system. That piece is missing in our industry. The other piece, of course, which they've touched on, is the packaging. When you go to a pharmacy or when you go to your cardiologist and they prescribe a medication, nobody asks you what flavor you'd like to sit, right? Unless you're a child. Medicine doesn't come in flavors. Medicine doesn't come in pretty character shapes and sizes and with fun names. So if you want to change the perception, if you want the public to take this seriously and take this as a medication and something that has a real impact on their body, you need to present it to them like a medication and treat it like that because it does have that kind of impact. So I think educating the staff like the pharmacy model and packaging it like a medication. And if we could have uniform packaging, this is almost too much to ask for. But if the dispensaries could package them in a uniform way, so now as a consumer, when I go to fill my prescription at any one of the dispensaries, I know I'm getting the same product. If you go to CVS or Walgreens and get your medication, it's the same medication in either place. And that's not true. So if you know what works for you in one dispensary, it's very challenging to go and find an identical product in another dispensary. So packaging and education would be my answer of what the industry can do to help with safety.
Yeah, so I think the juxtaposition is still there. So we were just saying how she can go online and you can, or we, not just you, can go online and order vape products and have them delivered to your door. So here in the state of Texas compassionate use program, we have those 3 dispensaries that I keep talking about. Their physical address that they're licensed to is the only place they are allowed to store product overnight. Think how big Texas is. Tell me what El Paso does. Tell me what Corpus Christi does. Tell me what these really far locations do to get these medications. But hemp products can be delivered to your door, right? So the safety has been taken to an extreme in a good way, I think, some ways. It should still be able to be stored in the same type of facility in a lock safe like it is at their things and other locations around the state to have good patient access. However, vending machines, which are accessible throughout the state of Texas that have hemp products. There are also, what's the word? The carts that you go up to. It's like a taco cart, like a kiosk stand, right? That also have hemp stores that are being sold out of there. At night, that is a very thin walled object, right? They're not inside an estate. There's no requirements for them to do that, right? So the safety of access is a big deal. In the medical world, there are, I'm going to say, some safety restrictions on the lids. There is, to get into gummies, you do have to do a push down and twist type things, and they do have what are approved in the hemp market, difficult to open Ziploc baggies at some of the stores. I will say Texas Original, and I think maybe the other ones too, they have limited their types of products by flavor. So if somebody tells me they're taking the sour peach mango, I know exactly what it is because that's the only flavor in that type, right? There's only one exception to that, which is strawberry passion fruit. But every other one, if you know the flavor, and most people can tell you the flavor of what they're taking, then you already know that it's a 0 to 1. You know how many milligrams it is, right? And so there's something really nice about that safety part of it, right? That makes it feel a little bit safer in the medical side of things, where I don't need the patient to be able to pick up the bottle and tell me everything about it. I know because the dispensaries are so limited on products that it's easier to kind of pinpoint what they're taking, which I do think has been a good public safety measure.
Awesome. I'm going to come down. Do y'all have questions that you'd like to ask of this panel? I'm going to need you to speak into the mic. Let me get the mic down to you for the live streaming so they can hear you online too.
Okay, well, I am a student here at Texas A&M, and I'm doing my first ever undergraduate research, and it is going to focus on packaging and labeling of cannabis products. And I loved everything that y'all had to say, and I think it definitely correlates with my research. But I was going to ask, what do each of y'all say to the people who are very pro-cannabis and very pro getting the laws passed and rescheduling? What do you say to those who say that the people who want regulation and strict regulation and child protective seals, what do you say to them when they say, you know, you're over exaggerating and it's safe, it's a plant, it's organic? What do you say to that, and how do we make sure that the policy is strict?
So I came with my stack of studies in case someone asked me a specific question. And this is just like the meta-analysis studies. This isn't all the studies. I have a whole Zotero file of all the different studies that I've come across. So I think you can hit people with the data, you know. Just because something is safer than something else doesn't mean it's safe for everyone. And really looking at, you know, obviously my focus is children and adolescents. It's not safe for them. It's not safe for them. We have plenty of data for that. Would I like more data? I would love more data. I also think advocate for research, which we don't have the best research we all know coming out of the US because of the complicated legal situation. But, you know, there's plenty of research out of Europe looking at these high dose products and risk of psychosis and age and risk of psychosis and stuff like that. So I think there's plenty of research to say that. I think we've talked about the tobacco industry a lot too, and I think there's plenty of historical evidence to say that the industry is not going to regulate itself, and that it is important to have guardrails in place for the protection of public health. That public health people need to be a part of the decision-making process here. If this were to become legalized, we would be starting from the ground up, and we have the benefit of the experience of other states to know. You know, obviously, what we have now is not working as far as keeping youth away. So I'm very against what we have now. And so, did that answer your question? Yeah.
I think I'd like to add one thing to that is that if we're having that argument, we all work in our own silos, right? We're all like, you know, up to our eyeballs in our own studies and research and understanding. And that would be where I encourage a collaborative conversation. And that's kind of where I've always come from, even in the alcohol industry. It was like, we're selling a legal substance. We need to make money. These folks over here study public safety and health. They have objectives to where can we come together to meet in the middle. And I think it's really so important that many more, and you will find folks on both sides that don't want to have conversations, but that's the only way that we get to the compromise to the middle where we have a functioning, marketplace where safety is at the table too. That would be my thoughts. Did y'all have anything?
Yeah, and I think as far, I answered this one about, oh, well, it's from a plant. I'm talking with parents who they're like, oh, it's fine, and I really don't like that comment. I mean, I'm here prescribing and helping them gain access, but I don't like that. I don't like that because penicillin, right? But there are people who are highly allergic to penicillin. There are deadly mushrooms, right? There are plants that if we ingested would be toxic and kill us, right? There are a lot of things in nature that will kill us. So just because it's natural does not make it safe. And that's always I kind of go, yeah, you're right. And it has some lesser side effects than some other medications. However, we need to remember that nature doesn't equal safe.
I don't have anything to add. They've answered the question. I'm just very encouraged that college students today are even asking these questions and doing these research projects. They talked in the last session, it's the long game. And I think that's true. And so I'm just very encouraged that you're even asking that question and doing that research. So thank you for being part of the industry and making it safer and better.
Most moral people want child-proof packaging. They just want everyone to have to do it.
Yeah.
Like if they're going to have that expense, they want everyone to have the same expense, right? I haven't come across a cannabis industry person who really is against child-proof packaging unless you're making them do it and not everyone else.
Do we have time for one more question? I'm sorry, I left my.
Yeah, we do.
Okay.
22.
Okay, perfect. So are there other questions from the audience? Yes, ma'am.
So I love hearing that you guys are very for this because I work for a bank and it's not something that we're interested in doing, banking any of this, but I love that that's some of the questions for our EDD and our enhanced due diligence and, knowing your customers, like if you are onboarding all this, are these dispensaries, are these people that are actually selling this, putting those safety features out there? How can we monitor that you are doing your training with your employees, people who are selling it? How do you enforce that on the retail side? Are there any other suggestions that you guys would have besides just the boring plain packaging, which we know that's just like eye candy for kids? Or, making sure ages. Are there any other things that maybe we're not seeing from that side that we should be looking for in these businesses? Saying like, do you have other options for safety features or things we should be looking at? Maybe we're not seeing.
Are you asking as a bank that's doing due diligence on a company?
Something else that could be taken at big dog, there's a certain guidelines and restrictions on what we should be looking at. But is there something further for our own understanding of what we should be looking at? What kind of products are there? Is there something that would be like, we call them red flags, It's like, what should we be looking at when we do a site visit or something like that? That would be like an automatic, whoa, no. That's definitely a safety feature other than the ones, that are kind of the basic standards.
So I'll answer it two parts. One, this doesn't exist yet, so you can't do this. We need a good, it's odd to ask for more government regulations because as a healthcare regulatory attorney, I spent much of my career fighting against government regulation. But if we had a standardized regulation, a lot of industries have training requirements. A lot of industries have continuing education programs you have to go to, and government regulators come in and say, show me the logs where you train people on this. Show me that people are certified as this is not new. So creating a standard that's verifiable is not new. Just somebody has to have the courage in the government to do it and then to enforce it. And then when you come in, you would just say, have you been surveyed by the state? Let me see your survey results. You failed this. Did you correct it? And then you could do that. Doesn't exist. In my perfect world, that would be the answer. I would say if you're walking into a licensed dispensary, I would want to know the ratio of your products. Do you have products that are high CBD, low THC, or are they all extremely high THC? Because that says to me, what kind of patients or what kind of customers are you looking for, and who are you marketing to in gearing yourself towards? You could look at the marketing. What is the messaging? Even when in Florida, we have 22 dispensaries, so as opposed to the 3, and they all have hundreds of locations. So you can walk into them and you get a feel, right? Does this feel like a place where people are coming to get help and get better? Or does this feel like a place where people are coming to get high? And it's not rocket science to do that on-site visit, but I would ask for the scope of your products and what are you selling? And if you understand those products, you can get a good sense of what kind of operator you're dealing with, I think.
And the only other thing I think is that you can do at home or at work at your own computer is distance to any kind of high school, middle school. There are no regulations to that right now. There is one that is quite literally, I think they mapped out 200 feet across the street from a high school, and it has no age limit for entry. That would be one I would not invest in. That feels like it totally goes against everything that we stand for. But that is literally a Google search at home that you can do easily.
Did you have a question also? Let me get you that so that online people can.
We do, and I'm kind of thinking on the banking side, we do own a kind of farm to table concept for hemp and CBD products. When we got into this industry in 2019, there really was no regulation. So we took it upon ourselves to do common sense regulation. My husband and I both he was in the federal side. He worked for FEMA, and I used to work as an assistant principal and principal of the city where we live. And so when we came into it because how beneficial it was for me and some health issues as a good alternative. But I have an 8 and 12-year-old too. And so it was very important for me to have common sense regulation. And we do work with a bank who does audits. And it's funny how they've asked us to help them support what to look for. We require and when you walk into my business, it's 21 and up on both sides. It does not look like at all like a smoke shop. We kind of mimicked an apothecary style. Everything's behind a counter. You can't just reach and grab. And we required on our POS to ask, just like any alcohol sale, for the date of birth. And so my employees have to enter the date of birth for anything that does have THC especially. And we do childproof packaging. None of this is required. It's just things that we do. And then we do have our COAs, and we make sure we audit ourselves that all labels go to the COA, because sometimes, technology, we forget or we glitch. And so I have an employee that does it every week, and especially with every new product. So those are just common sense things that when we started working with our bank and they were auditing us, it was like, oh, here's our COAs, and they keep a template, we keep a template, and they do an audit every year. And then Square also, because I use Square as my payment processor, they also audit us every year. So for me, it's very important to keep those up, because this is our livelihood. We've invested a lot in this, and I don't want us to be one of those that, get raided or have issues. So but you're like you guys commented, it's frustrating to see all that we invest for common sense regulation, and so many people around us don't. And so it hurts us it'll hurt us in the long run as well.
Well, I commend you for that. And I will say though, on the other side of this, when all of these regs do get fleshed out, you'll be one of the ones standing. So, just feel comfortable in that you're already taking the steps that are going to eventually be required, right? And so this is already a risky business. It was risky when it started out west. And there are some that won't make it because they aren't doing the things that you're doing, and you've already taken it seriously and built your model on that. So thank you for those comments.
You also raise a good point that the motivation of the founder, I have found, sets the culture. And if you've got founders that they're creating a company for the right reason, that permeates through the operations and the culture forever. If you've got founders who are there because they like pot, that's fine, but you're going to get a business that favors smoking pot, as opposed to a doctor starting a business or people who are doing it for the right reasons.
I suspect we're running out of time here. Okay. Are there any other comments from the panel that y'all would like to make in closing? I think this was a great discussion. I want to thank you all for coming and joining us. I know this was a small group, but it was a really thoughtful conversation, and I appreciate you listening to what we had to say on the topic. This is incredibly important for a responsible industry to be able to move forward in a meaningful way. So thank you for being here, and thank you for your attention today. And thank you all. It's been a pleasure.